Hello, John Frioli. I just wanted to talk a little bit about why healthcare costs as much as it does today. I wrote this little paper back in 2012, and it was basically right out, kind of after the Affordable Care Act came into being. A lot of people like health insurance. But actually, it's health insurance is the reason that health care costs as much as it does today. I'm just going to go ahead and read this because it's a lot easier for me. I started off by saying the Affordable Care Act was never really designed to bring down the cost of health care. At best, it might have been able to lower the cost of health insurance, although the jury is still out on whether even that has occurred. Of course, now we know that has not occurred. Is anybody aware of any hospitals, physicians, or other healthcare providers that have lowered their fees since the Affordable Care Act was put in place? I think not. The only true way to bring down the cost of health care, and there is one other way I'll explain at the end of this, is to do away with health insurance altogether. Let me explain. The reason that health care costs as much as it does today is because there is such a thing as health insurance. When health insurance first came about in the early part of the 20th century, it allowed doctors to substantially increase their fees and get this, not lose any patients. That is because the patient didn't care what the doctor was charging. They weren't paying for it, the insurance was. So if there had been no such thing as health insurance and doctors tried to increase their fees, let's say tenfold overnight, patients would not be able to afford that doctor and would seek out a less expensive doctor or just choose not to get care. So the government has it all wrong. The only way to really decrease the cost of health care is to have nobody insured, not to have everybody insured. If no one had health insurance, health care providers would have to lower their fees, or they would only have a few wealthy patients. Add to this the fact that insurance companies have to keep their profits up, and that just compounds the problem, adding even more to the costs. Health insurance was the biggest sham ever perpetrated on the American people. It was, however, great for healthcare providers. On a side note, the same could be said for auto body repair. The only reason that auto body repair costs as much as it does is because there is such a thing as auto insurance. And it's mandatory to boot, just as health insurance now is. If there was no such thing as auto insurance, and an auto body shop tried to charge those extremely high prices, most people would just choose to drive around with the dent. So if the shops wanted much business at all, they would have to lower their prices. As it is now, people don't care what the auto body shop charges because they're not paying the bill. The insurance company is. This accounts for the high cost of auto body work. For the record, I do believe that physicians and auto body men do work very hard. Neither job is easy. Aren't you glad there is no such thing as plumber insurance? At least not mandatory. Plumbers could then charge substantially more than what they currently charge, and we would be paying up the yin-yang for the insurance. I did mention earlier that there was one other way to lower the cost of health care, other than getting rid of insurance entirely. The only other way to do it is have health care providers cut their fees in half. If they charged half of what they're charging now, then the cost of health care would be half of what it is. That is one of the other really only truly other ways of lowering the cost of health care. I hope this made sense to you. If not, listen to it a couple of times. Thanks.